Okay, welcome to all. Today uh, we are going to discuss actually today we are going to discuss about endometrial cancer and its radiological finding. While I was cooking, I received a call from my friend from Stuttgart that there are some abnormal findings of ultrasound of his wife. So he asked to explain. So that simply I am explaining that. So before going to the ultrasound image, few terms should be known who are in a non-medical field. So taking one pen. Next. Okay, so first we should know the reason. What should be the reason? So the main reason is the obesity, and there is a recent finding from I think Oxford University. I can't remember exactly. Just 2-3 months back I was reading that article that lack of protein during menstrual bleeding also may cause this endometrial cancer or some type of hyperplasia. So definitely during they have strongly recommended that during menstrual bleeding the protein supplementary should be enough. Another reason is, common reason is junk food and lifestyle. We are taking so many outside food, always outside, that pizza, burger and all this. These are the data statistics I found. These are the reason. There may be family history or hormonal disbalance during menopause. So what could be the pre-malignant condition for the endometrial cancer? So the pre-malignant condition is called the endometrial hyperplasia. It's nothing but proliferation of endometrial glands, just it is bulged. Okay, that means the inner lining of the inner or the outer, the lining of the uterus, that means the endometrium, becomes unusually thickened. Okay, sometimes it's hyperplasia may not called cancer, but there is a risk of uterine cancer in case of hyperplasia. So you see, this is the microscopic view of normal endometrium, and this hyperplasia is classified, broadly classified into two categories. One is simple hyperplasia, another is complex hyperplasia. So the abnormal cells, the proliferated cells in case of simple hyperplasia, that is mildly crowded. You see, there are very less number of dilated cells, and this proliferation is basically seems to be cystically dilated. It's like normal cyst, okay, and there is no that much outpouching. But in case of complex hyperplasia, you see the proliferated cells are more crowded. It's more crowded, and there are, you see, you can understand these cells. Anybody seeing that will understand it is cystically proliferated. But you see in this cell, see there are more luminal outpouching, okay, and this kind of cells, this kind of dilated cells are heavily crowded. So this is called complex hyperplasia, okay. Another term you should know, this is a normal cell. So this is your cytoplasm, this is the cell wall, cell membrane, this is the nucleus, and nucleolus is a normal cell. But in case of atypical cell, the nucleus are dilated, it's bulged, proliferated, abnormally, which is compressing the cell cytoplasm, okay. So the volume of the cytoplasm reduced due to the dilation of the nucleus, and due to this reason sometimes the cell membrane or cell wall will become weak, and this will cause this kind of luminal outpouching, okay. So this kind of cells, if it exists, this condition is called atypia. So now, according to the classification of WHO 94, the endometrial hyperplasia is divided into 4 groups. Simple EH without atypia, that means there is no atypical cell. The complex hyperplasia without atypia, simple endometrial hyperplasia with atypia, that means there is atypical cell with bulged proliferated nucleus, and complex endometrial hyperplasia with atypia. So these are the data analysis. Data statistics says that simple EH without atypia, there is a 1% risk. Complex EH without atypia, that is 3%. Simple EH with atypia, 8%, and complex EH with atypia, it is around 30%. Okay, this is the as per the WHO 94 classification and based on the data statistics. Now this is the transverse image. You can see this is the basically it's ultrasound. If you put the transducer in perpendicular to means along the transverse plane, then this is the very normal ultrasound. So you see this is the uterus, okay, as you see. This is the uterus. This is your left ovary. This is your right ovary. Okay, this is the normal ultrasound. To give you the who are not familiar with the ultrasound, for them I am showing this. So I have hidden the name and all. Now here you can see in the image, these are the, so it is evident from this ultrasound and whatever we understand from the previous slides that there is hyperplasia. Okay, you see here. But one thing it is true that in my opinion, it's, you see, if you go to the previous slides, you see this is something like simple hyperplasia. It looks like this, not like this. Okay, so if you see that, so it is the proliferated cell, those are mildly crowded, and it seems that it is cystically dilated, and there is very less here. Only we are seeing some outpouching, others are cystically dilated. So it seems simple endometrial hyperplasia. Okay, so you see this is the biopsy image of complex endometrial hyperplasia with atypia. But here it is, even though that ultrasound is not enough to understand that, but grossly it could be could be concluded that this is a simple EH without atypia, but still biopsy is needed. So my suggestion is, after biopsy, with this report, all these things you have to discuss with the gynecologic oncologist and start the medication and a treatment immediately. So hope very simply I am able to explain you what is endometrial cancer and endometrial hyperplasia. So my best wishes to her for quick recovery and come back to normal life. Thank you so much. So it's late night. I need to take my dinner. Thank you so much. Thanks for your patience.